Bismillahirrahmanirrahim. This is Dr. Mujtaba Hassan Siddiqui. I'm a consultant physician endocrinologist, and I'm going to continue in the module which is devised by Ferozson's Save Limbs for Life. So, this is my humble introduction. I'm working in a private medical college as professor of medicine and consultant endocrinologist. So, we have module 5 today, and we are going to discuss who can have an ulcer and who are the people at risk. So briefly today we are going to discuss the risk factors for diabetic foot ulcers, and very briefly we are going to talk about the types of ulcers and the different types of ulcers and how to manage the ulcers. So the objective of this program is to save the limb because limbs are life. You know, if we lose a limb, it's going to have a lot of burden on the rehabilitation of the society. You can imagine a patient without a limb who is the breadwinner of the family and how his family is going to survive. It's a lot of burden on the society, on the family, on the exchequer of the government. So our main objective is to save the limb because limbs are life. So what are foot and toe ulcers? We are going to define ulcers, wounds in your skin that can get infected and take a long time to heal. These wounds in the form of ulcers can be found on your feet, on your toes, because this is the area in which ulcers are predominantly developed, because that is because of the gravity. The blood supply goes downwards, and we see that the patients who are having diabetes and who are having complications of diabetes like diabetic neuropathy, they are prone to have these diabetic ulcers. These ulcers can get infected sometimes, then they can turn into wounds and then abscesses, and then unfortunately they might require amputations for your foot or toes. Healing of these ulcers involves both medical management and surgical management as well. So what are the characteristics of ulcers? There are different types of ulcers, there are different shapes of ulcers. They can have any shape, but the most common shapes of ulcers are, or that is on the specific parts of your body. Majority of these ulcers, they are on your foot and toe, so they can take the shape of a crater or a wedge-shaped ulcers. They vary in color, and a number of colors might be visible in these ulcers, which might be yellow, pink, red, gray, and black. If the ulcer is black, it means that there is necrosis of the tissue, meaning the tissue has died. You must have read this in pathology, that when there is necrosis, the tissue death has occurred, and this can cause gangrene of the toe. Ulcer types and grading, there's a famous classification which is called a Wagner's classification, which has been devised for the classification of these ulcers. So we know that the sizes of the ulcers, they vary a lot. They may be small as 1 centimeter, about the size of a pea, and they can increase and they can involve the whole limb, whole feet. So the size may vary from a very small ulcer to a very large one, and the depth of the ulcer also changes. It might be a pretty superficial ulcer which is not involving more than the skin. It might be very deep, which might go up to the bone. So the classification, Wagner's diabetic foot ulcer grade classification, according to this we have 5 grades starting from 0 to 5. So we have a total of 6 grades. Grade 0, when your skin is in intact, that is undamaged skin. Grade 1, the ulcer is superficial, when means the skin is broken. Grade 2, when the ulcer is a deep wound, it's more than skin. Grade 3, when the part of your foot bone is visible, yani grade 3 ulcer reaches the bone. Grade 4 ulcer, it means that the necrosis or the gangrene has started. In grade 4, there is partial gangrene of your foot or limb, and in grade 5, the entire foot has got a complete gangrene. We must know what are arterial ulcers. You know, the diabetic patients, they also have complications like high blood pressure, dyslipidemia, so they are prone to have peripheral arterial disease. You know, diabetes is equivalent to ischemic heart disease. So ischemic heart disease is also an arterial disease, that is because of the closure of the coronary arteries. Similarly, we have peripheral arterial disease in which we have clots in the peripheral arteries, so the blood flow to the extremities is lower. When this happens, the foot tissue might undergo necrosis, and this can lead to gangrene. The ulcers which are produced from reduced blood flow through the arteries are known as arterial ulcers. The people who smoke, you know, smoking is a risk factor for peripheral arterial disease, And other risk factors are diabetes, high blood pressure, dyslipidemia, and so on and so forth. Unlike neurotrophic ulcers, arterial ulcers can form on any part of your body. It can be there on your heels, on the tips of your toes, between your toes, that is the finger webs, the bony part of your feet, and the toes that rub against the bed sheet, socks, or shoes, into your nail beds. And unfortunately, if you remove your nail, ingrowing nail in an improper manner, it can develop there with quite aggression. People who are at risk of diabetic foot ulcers, the diabetic patients, they are at risk of ulcers because they have peripheral neuropathy. If a small wound or even a simple pinprick is missed by a patient, this can lead to a wound formation. Then later it can lead to an abscess formation, ultimately end up with an ulcer. Of course, peripheral arterial disease plays a role, as I have already mentioned, and infection by the bacteria. Infection can play a lot of role, bacterial infection, because they will delay the healing of the wound, hampering the healing of the wound, and it unfortunately will lead to a gangrene. The risk factors associated with foot ulcers, there are a number of risk factors. We will discuss one by one. Male gender, males are prone to have risk factors. Duration of diabetes, if the diabetes is lasting more than 10 years, then it's going to cause ulcers. Peripheral neuropathy, as we have already discussed. If the patient is having any congenital foot deformity, he is prone to have ulcers. Charcot joint patients, they are prone to have ulcers. Peripheral vascular disease, or specifically peripheral arterial disease, the patients are prone to have ulcers. Smoking, you must have heard about Berger's disease, thromboangiitis obliterans in the lower limbs. So smoking is prone to cause peripheral arterial disease. History of prior ulcers or amputation, poor diabetes controls, genetic factors, nutritional factors of high lipid diet, and of course diabetic retinopathy and nephropathy. All these are risk factors for foot ulcers, so we have to prevent all these risk factors to treat our patients. As I've already mentioned, the neuropathy, which can be motor, sensory, and autonomic neuropathy, which can lead to formation of an ulcer, and angiopathy in the form of peripheral artery disease. This can cause diabetic foot ulcers. Now we are going to touch about another topic, which is diabetic peripheral neuropathic pain. You must have heard about diabetic peripheral neuropathy, which we have already talked about, and we must know what is diabetic peripheral neuropathic pain. It is the definition of it is the presence of symptoms and signs of peripheral nerve dysfunction in patients with diabetes, and you must rule out other causes of peripheral neuropathic pain. If the other causes have been ruled out and the patient is having diabetes and his diabetes is for the long duration and it's not controlled, then the symptoms and signs of nerve dysfunction can lead to diabetic neuropathic pain. The neuropathy can be sensory and motor, and it can be autonomic as well, and this is the most important cause of diabetic ulcer. Symptoms and assessment of neuropathic pain: reduced sensation to pain, temperature and vibration, uh, good pulses, warm foot, presence of edema, dry skin, especially on the plantar surface, and infection. When infection is there, the patient is prone to have diabetic foot ulcer, and the complication will lead to gangrene and ultimately amputation of the toe or the limb. Neuropathic foot ulcer, we should examine for these things. We should examine for pulses, peripheral pulses. Clinically, it's very simple to examine for the pulses. You can start from the dorsalis pedis artery. You can go back to the anterior tibial artery, posterior tibial artery. If the skin is warm, so most likely the blood supply is going on, or if it's too much warm, the complication can be there in the form of cellulitis or other thing. Dry skin, decreased sweating can be a part of autonomic neuropathy. Loss of sensation can be a part of diabetic neuropathy. Orthostatic edema, definitely must have seen so many patients with edema in diabetic patients. High plantar pressure can cause these complications, and these patients are prone to have infection, which can hamper the healing of these ulcers. Three factors which can cause diabetic ulcer leading to gangrene is angiopathy, microangiopathy, and macroangiopathy in the form of peripheral arterial disease and ischemia and neuropathy as well. Diagnosis of peripheral arterial disease is very simple. You remember, we always rely on history and examination. So the history and examination is the most important part. Peripheral pulses examination is extremely important part. Examination of neuropathy, examination of sensations is extremely important part. So you can examine and you can clinically find out if patient is having diabetic neuropathic symptoms or not. Then bedside ankle brachial index is very easy to do. You can do it with simple Doppler at the bedside of the patient. CT angiogram is definitely investigation of choice, which can tell you exactly at what level of the arteries there are clots, and peripheral arterial disease is up to what extent. And of course the magnetic resonance imaging or magnetic resonance angiogram if needed. This is the same slide which we have already discussed, just a repetition of Wagner's classification of diabetic foot ulcers. In grade 0, there is no skin break. In grade 1, there is breaking of the skin. Skin involvement is there. In grade 2, it is penetrating wound going to the ligaments and muscles, but no bone involvement is there. In grade 3, the deep ulcer reaches the bone. In grade 4, there is localized gangrene, and in grade 5, definitely there is a generalized gangrene. This is a schematic presentation of how these diabetic foot ulcers develop. You know, when diabetes is diagnosed and long-standing diabetes with complications, it's going to cause sensory neuropathy, which can have loss of protective sensations, which can cause decreased sensation, and patient is prone to have infection. Autonomic neuropathy can cause loss of sweating, dry skin, callus formations, and the foot is at risk. Peripheral arterial disease, as we have already discussed, this can cause clotting in the peripheral arteries, which can lead to decreased blood supply and ulcers. Risk of ulceration in categories, we have 4 categories. Very low risk patients, the risk category is 0, low risk patients, moderate risk patients, and high risk patients. Remember, if you are going to save the limb, we have to start from the very beginning. From the very low risk or low risk patients, you have to start. Okay, now I'm going to show you a video in which there is cleaning of the callus formation and the basic management of diabetic foot ulcers. A diabetic foot specialist is going to manage these patients, so I think this video will help you understand how to remove this callus and how to manage the diabetic foot ulcers and the basic principles of the management of diabetic foot ulcers. So this was the brief module, and of course at the end there should be some brainstorming. So I'm going to ask few questions from you. The question number 1 is, if your ulcer is black, that means cells in the tissue have died. What is this called? Yes, the answer is necrosis, that is the gangrene of the foot or the whole limb. The next question is, the Wagner's diabetic foot ulcer grade classification system is based on how many grades? You remember I discussed this classification twice. So this is based on 6 grades, which start from grade 0 and go to grade 5. I hope you have learned the basic principles of diabetic foot ulcers from this presentation. Thank you very much.